Gotcha.
Ow.
Are you okay? Did I hurt you bad?
No.
Walk, just walk, just walk. It's okay. Welcome to the office. Hi, Leah.
Hi.
Welcome back.
Thanks.
It's been a minute.
I know. Thanks for having me.
Thank you for coming.
Of course.
What's going on? Well, hold on.
Yeah.
It's been a long time. It's been a few years.
Yes.
And you first came in 2018. We're now 2024, 6 years later. What's going on?
Currently,
Yeah, why are you back?
we made a lot of progress.
Okay.
And I was feeling really good.
Okay.
And I was like, I'm cured. I don't need that guy anymore.
Because you felt good.
Yeah. And I think also there's a part of it where you're like, I did it, but then the upkeep, I think maybe overwhelms, or I don't need it. Or
hold on,
just,
when you say you did it, okay, we had maybe 4 or 5 visits.
but they were real good.
And, okay, thank you.
You're welcome.
But we had 4 or 5 visits. We had some deep adjustments. We had emotional releases, which was intense. During that process, you were feeling better, you were functioning better, you had less pain.
Yes.
Okay, and so you thought everything is fine, I'm getting on with life. Okay.
Yes.
And it's been a couple of years since I seen you. Okay. So tell me now, why is that? Because we didn't fix everything.
No.
You know that, right?
I know that.
We didn't fix everything,
Yeah.
but you were functioning better than you were.
Yes.
Because I remember the first time you came as a visitor with a patient.
Yes.
And you were a visitor, and you were just sitting there, and I could tell you wanted an adjustment so bad.
Yeah.
Right? I know you wanted it so, like you were like, I want to be in that chair. And then you were.
Yes.
And then
I cried.
And then you cried. Why'd you cry? Everybody wants to know, really. Why did you?
They want to know why I cried?
They want to know. They think, a lot of people think I hurt you.
No.
Like physically,
physically,
like I
no.
physically hurt you.
No.
What was it?
I think when you go so long without taking care of yourself and feeling like people are sitting and listening to you, I think I've just had so many bad experiences with doctors, putting Band-Aids on things, or I only have 10 minutes with them. But I think because it was like the first time, one, I was doing something for me. I felt like I was being seen and listened to. And then, you know when you put expectations on something and it doesn't happen? But this time I put expectations on it and it did happen.
Okay.
So I think I don't know, it felt like a build-up that needed a release. And I guess what I came up with that day was crying.
Okay.
Which is better than screaming, I guess.
Sure.
But physically...
Laughing, giggling.
Well, yeah.
That happens too.
Physically, you did not hurt me.
Okay.
I
just want you guys to know this.
Yeah.
So you went through first about 4 visits.
Yeah.
4 visits.
Yeah.
And then you went on with life. And as you're going on with life, what happened?
I think physically, stuff didn't come back the way it was, like how extreme it was. But I still have, which I tend to recognize are like in stressful moments.
Okay.
That I'll have months of specific areas that are flaring up again.
During stress?
I feel like it's stress related.
Okay.
Because like sleeping problems will happen. I'm never comfortable. I never feel like my head rests on a pillow. It feels like it's kind of always hovering. I'm always cracking my neck.
So I didn't teach you anything?
No, I now know how to crack my neck. Oh, the stretch, yeah. I only saw that on a video, though. You didn't teach me this one. This one's new. So yeah, so I think things came back a little bit.
So one of the things, we want to talk about before we get started is, you came 4 or 5 visits, you did well, I'm assuming you were able to do more stuff than before coming in, activity-wise?
Yes. Physically?
Physically, I mean.
Yeah,
Physically.
yeah. I definitely, because I was running a lot when I first came to you.
Correct.
I was like a big,
You're doing marathons.
I was doing marathons.
Yeah.
I've done 7 marathons.
You still doing marathons?
No.
Didn't get hit by any cars?
No new car wrecks.
No.
That's not true. Oh no. 2 years ago I got in another car accident and I had a panic attack.
Rear-ended?
Yes. And I wasn't driving. I was in the passenger seat. But I had a panic attack, which I never have. And I don't like using that word because I feel like it's overused. But I was genuinely hyperventilating, panicking, and I was triggered back to those big car accidents that I was in.
So you're still storing it?
Yeah, probably.
Okay.
Yes. If I'm
But remember
freaky.
we talked about the tailbone injury and you discovered it on the 4th visit. We had a discussion. And it was something about a swimming pool.
The swimming pool, yeah.
Right?
Yeah.
So that we kind of discovered that.
We did discover that. I forgot about that.
Yeah, that was important. Mm-hmm. So physically, pain, discomfort.
Left side spine here, which I think was what we were always kind of working on.
Left side low, left
Sorry,
side
right
middle.
side.
Right side low, right side middle.
Middle.
Okay.
So I like to kind of dig in there still. Neck is still kind of like these areas.
Both sides, left side.
I think left side.
Okay.
I think I'm rubbing more the left side. My jaw recently has been clicking. Clicking seems extreme, but I noticed like a pop or something.
Left side, right side, both.
I think both, but
Okay.
maybe more this.
Okay.
I think maybe more this side. And I tend to rub it more, which I didn't know if that's a stress thing.
Could be. We're going to check on the exam.
Okay.
We'll check on the exam. We'll figure out what's going on with the TMJ.
Okay.
So right side, low back, left neck.
Mid-back.
Mid-back, neck.
Neck,
Left
always.
side. Yeah.
And then we used to, my hip, I do this weird like leg swing thing to pop it,
Okay.
which is new.
Okay.
It's kind of a cool thing.
Why? To pop it.
To pop it. It feels like it needs like a,
Your right side.
I'll do both, but it feels mainly
Mainly
this
right.
side.
Okay, that makes sense. Sprains, ankle sprains, and any marathons?
No. I'll probably do one this coming year, but
Okay.
my knees are always just weird and knobby. But that's just a aesthetic thing, I think, that I can't control.
Knobby? What's knobby?
Knobby knees?
I've never heard
Knobby
that.
knees?
I've never heard that term.
Oh, well, you can just
Knobby
look at my knees.
What's a knobby knee?
Knobby knee? No? Am I
Knobby knee?
making words up?
It sounds-
No.
it
That's like a
sounds-
Minnesota thing?
It sounds like a new language.
Okay.
Knobby knee. She had knobby knee.
Okay.
You got knobby knee. Knobby knee. Okay, knobby knee. We took some new x-rays. Mm-hmm. We're going to go over your x-rays.
Okay.
We're going to see kind of where you're at. And we have a couple of visits to get you back in balance. Because that's what it says up there. Mm-hmm. And I want to talk about that briefly. Because a lot of people come, I mean, it's been a blessing. People do come from all over the world. And they're looking for an answer. But they're also in a lot of pain. They're in a lot of chronic pain. And one of the things that they want a quick fix. They think they're going to come here 4 days and I'm fixing everything. And I'm not fixing everything in 4 days. Okay, in 4 days I'm figuring out the case, sometimes faster, but I see how the patient responds. But I have pain here, and I have pain here, and I have pain here, just like you said, I have this, this, and this. But my job is really what's out of balance that's causing it. So someone will come with a neck problem recently, and I adjusted his T5, and the neck pain's gone. Someone came in with a shoulder pain, we adjusted the neck, it's gone. Someone came in with, so it's anything can cause anything, and it's not so much I'm chasing the pain. My shoulder hurts, you have to work on this. My knee hurts, you have to work on this. It's what's out of balance. Let's get you back in balance, and let's figure out the habits that need to change. That's the key. Make sense? Mm-hmm. You ready?
Yeah.
Let's do it. Number 1, we're looking at the posture. Number 2, we're looking at the curves. Number 3, we're looking at the disc spaces. And we're going to point out a few things along the way. So the first thing we're going to do is let's go ahead. Dude, you got antennas in your head.
I know.
Interesting.
I know.
Now, normally when we're doing the posture assessment, it's the lowest lumbar vertebrae. In your case, we know we have a transition vertebrae. Your L5 is now part of your tailbone.
Because that's what we said last time. It's like connected.
Correct. So you have 4 lumbars that move instead of 5 lumbars.
And that's bad.
So there will be some stiffness there, and you require more flexibility work down the road. Okay? Posture. From the lowest lumbar, this line should bisect here, 7 and 2. What we see is you carry your upper body slightly behind the foundation. So as a result, what's going to happen? These muscles are going to get tighter.
Yeah.
So standing or sitting a long time when you're writing on the computer, you write this way or you write this way?
Both.
Both?
Both.
You're still using pen and pad?
Yeah.
All right, cool. But when you're doing that, I'm sure you get tight in the upper back and shoulders, right?
Well, and sitting, I always am hunching. Like that's the more comfortable.
Okay. All right. So that's a good test for us.
Okay.
So we'll see after a couple of adjustments, it should be uncomfortable to slouch.
I would like that.
Okay. So that's number 1 is posture. Number 2 is curvature. When we're looking at curve, I'm going to move this out of the way for a second. You curve back okay here, but starting here, it goes way back. 5, 4, 3, 2. So 5, 4, 3, 2. I'm going to zoom in a little bit. 2 starts this compensation. So actually it's going to be here. 5, 4, it's going to be 3. 3 goes back, 2 compensates, this compensates. And why I'm saying it compensates is because I'm looking at the circular patterns. And the circular patterns means it's tilting. So they should be level and parallel. This one is level, but they're not parallel. You can see it's slightly back. Then what happens? This thing sways back a little bit. As it's swaying back, coming back, it needs to come back to neutral. But what's happening in your case, it's staying back. So the question is, which one down here is actually causing it? It's coming from here somewhere. Okay.
Would that be that pain that I'm always having here?
Correct.
Okay.
But that pain that you're having here could also be a compensation. It's trying to hold you up.
Okay.
Okay, so posture is going to be key. As we go up the spine, when we look at the neck, it's a little straight. But when we get closer, we see this. This one tilts back here, 7, 6, 5, 4, 3, 2. And you don't have it yet, but you could start to develop a slight reversal. It's better than what it was.
Oh, good.
That's the good news, okay? Now, you got some extra things going on in the body. We'll talk about it on the other x-ray. Okay. We have the coccyx. We already talked about these tailbone injuries from the past. And even though this is a transitional segment, the disc is level, you still have the hole where the nerve exits, so you're good.
Okay.
Okay, that's all good. Now let's go to the A to P. Overall, when we look at it, it looks pretty straight. It looks a little kinked over here on the left side, but let's talk about it. Let's talk about your foundation and where it's at now. When we're looking at your foundation, a couple things going on. We have the rotated sacrum on the left side. We have the rotated pelvis. So the way the pelvis work, they work in opposite, and I'm just recapping, right? One goes up, the other goes down, one goes in, the other goes out. You don't have up and down misalignment of your pelvis anymore. You have internal, external. Now I'm referencing the left side. Whatever I say on the left is opposite on the right. The left side does this, so it goes in. I'm referencing, here's the spine. So this is the left side, this is the PSI, it's the dimple in the back. These are the dimples. The left side turns in, and the sacrum goes back with it. So the overall effect is your foundation wants to go to the left. You have a slightly lower leg on the right side, or a short leg on the right side. Right now it measures, the MD is 8 millimeters. It needs to be under 7. The good news is correction of your pelvis, whether it's left or right, will bring it up to 6. Okay?
Okay.
Now, when we're looking between sacrum and pelvis, the book says to do the sacrum. But whatever shows up, shows up. Okay, now I'm going to go a little darker here because I want to show something. And what I'm seeing here is this part here, S5. Your sacrum bends like this, okay? That's where most of the short leg is coming from.
Okay.
It's coming from this bend. Do you see what I'm showing you?
Yeah.
Okay, this bend. And that line right there, let me zoom in. That line right there is parallel with this line. So the short leg is coming from that initial tailbone injury. Okay?
Okay.
Let's continue. Other findings on X-ray. We talked about transition. We talked about the transition. We have a little bit of the non-union of the spinous processes. As we go up, I'm trying to figure out, I think you know what that, I figured out what that is. This is soft tissue and that's gas. So there are two gas bubbles in between the soft tissue.
Okay. First it was poop and now it's gas. Is this the right side?
This is the left side.
The left side. So I have a big problem here.
Correct.
That I've had, and they went and did ultrasound.
Okay.
And they found a polyp
Okay.
that was 5 millimeters.
Okay.
And they said, well, I didn't actually get a follow-up. So I got to get a follow-up of what I'm supposed to do with that.
Now I changed the contrast. Now you see all the gas and poop?
I mean, there's a lot of things in here. What is
Okay.
like that? What's that? That poop?
Poop.
Great.
Poop.
Poop.
Poop inside gas. That's poop inside gas.
Okay. Well, at least
Then-
they're making friends.
But here, this whole left side, it's not just the polyp. This whole left side, that's all fermented. That's all gas. Now, as we go up, so the rotated sacrum on the left is causing rotation here. It's rotating all the way up to about. Nope, it keeps going all the way to here. So 1, 2, 3, 4, 5, 6, 7, 6. So everything from the sacrum.
Oh, sorry.
Everything from here to here, all of this is actually compensating for your tailbone. But if there's pressure there, long-standing compensation can be subluxation or a problem. Then we have a little bit of this is the spicy one here.
What's like, oh, these are part of the bone.
Yeah, these are all these are the spine, these are the bumps on the back.
Right, these little guys, right?
Well, yeah, so
Cute.
these are the bumps on the back.
They're
And they're
cute.
different shapes, right? You can see they're more pointy,
Sure.
then they bend down.
Is that the medical term?
Yeah.
Pointy?
Yeah, they're pointy. Then they bend down. They're called imbricated spinuses because they lap on top of each other. There they don't. And then here they're more They're more like nubby. So pointy, imbricated, nubby.
Nubby and nubby.
There's my.
It's good.
Pointy and nubby. That's my medical term for today. Okay, as
And
we
then
go.
why are the collarbone, because I broke my collarbone. Is it fine that those are not aligned?
It's not so much that the collarbone. We're looking here.
Yeah.
And if we see, you broke both of them. Left one.
Left.
Yeah, right there. So if you look at the shape here, it goes like this. If you look here, it goes up, over, and that's where the break was. But if we're looking at the shoulders generally, you can see from this bend, it changes the mechanics.
Okay.
Okay? But we'll work on the collarbone down the road if you want to.
I think it's fine. I just didn't know if that was anything with the neck related.
It could be. It could be the muscles could be pulling on the SCM muscles. But we'll look at it first from the spine, then we'll look at it from the shoulder, and then muscle stuff we'll talk about later. What's up with your nose?
Well, I want a nose job. So.
Okay.
Why?
The
What do you
left side has more air, right side has less air. Right side is more congested on the X-ray. And let me show you what I'm saying. That's the airway. See this kind of dark area? You see there it's pinched?
Sure.
Do you see what I'm showing you?
Like it's a little grayer?
It's almost like a funnel.
Okay.
You see all this space here?
Yeah.
What happened there?
Okay. Could it just be daily congestion, or do you think that's like...
We'll find out when we test it. Okay. Questions so far? So the overall there's a lot of good changes that happened in your spine. What I'm looking at, on this round is going to be to get this side up. That's number one, to get the right side up and to get the foundation right. That's my main focus.
Okay.
Everything else is bonus, so to speak, because I said everything from here to here is compensating. Digestion is happening here. Okay? Digestion, you can see this kink going on here. So when you said, if you lay on your right side, you feel like you're floating. You don't feel like your head is going down. On the right side, I'm assuming.
I feel like it's both, but probably.
Because you see how it goes. So if I turn this, so if you look here, you see how from here it goes up. So if you have pillow here, you have to flop your neck down a little bit in order to get on the pillow. But if we go the other way, it's not the same. Okay? All right, let's get started. Okay, so what we're looking at first is we're looking at the overall contour of the spine. We don't see the spine there. There's obviously going to be a little bit of swelling there. When we look here, can we see the dimples? A little bit, but we can also see a little bit of swelling. Okay, a little bit more on the left side than the right side. We're looking at the shoulders. The right one, the scapula looks down on the right, up on the left. If I put my hands on top like this, it's more winged on the right than on the left. Look straight ahead, please. And as we go up the spine, you can look from behind. The left ear looks higher than the right ear. Okay, let's go ahead and walk to the end of the room. So we have a different walk now here to the end of the room and back. You're going to walk several times back and forth. Okay, keep walking. So you've compensated very well from what I see on your x-ray. Yeah. Okay, so we should be seeing more of the wiggle in the hips. And it's there, but it's very subtle. It's not as pronounced as you see in some patients. Let me fix the gown, please.
What's interesting is like when I walk, I'm very aware of.
So I want you not to be aware. I want you to just walk.
Okay.
Just walk, please. The best you can. Okay, seriously. Gangsters don't dance, we boogie. Now you see it. Now you see it. See, you were being conscious of that.
But you know what's funny is I used to work at a restaurant and my bosses would always make fun of the way I walk.
Okay.
Because I think I walk very masculine. And they would always like make fun of me because I think I compensate my little size with being like what?
Like what? Yeah, you try to be a bad butt.
Yeah. So does this look more like normal?
Yep. Now you can see that lumbar spine kick off to the right side. Keep going, please. Walk on your toes. Turn around, walk on your heels. Now you see it. Boom, 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 boom,
That's
boom,
hard.
boom, boom. Okay, come on back.
Okay.
Have a seat over there. I can do some comments on her walk later too. Okay, let's go ahead and run the meter on the spine. Dun, 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 dun. Doo-doo-doo. Head down, please. Starting at the base, look up a little bit. Starting at the base of the neck. And the first thing we're getting is 6 on the left, 5, 6 points, 10 points, right side, upper cervical. T5, T6, left side. Alrighty. Do, 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 do. You said you were feeling it where in the back?
Like right here usually, or on this area.
Okay. It's not coming from there.
Okay, good.
It's compensating. It's compensating for the sacrum on the left.
Yeah, because that spot is like the spot I'll always like dig into with things or.
And remember I said a lot of this is all compensating for down low.
Right.
You feel it right now?
The pain?
Yeah.
I think there's always like a numbness.
Do you feel it right now?
Yeah.
Okay, so we're down in that S5 coccyx area, left sacrum, T5, T6, C6, and upper cervical, C1, or maybe the occiput. Okay, let's do static palpation now. Do-do-do-do. Head down, please. Do-do. So what videos did you watch before you came?
Oh my gosh, it was so long ago. I don't even remember.
Did any one of them stand out?
Not until mine came along.
Of course.
Honestly, it's been so long, and then I think when I was on, I think I wasn't watching them the same as I was on YouTube before. Oh, what the hell is that?
Mm-hmm.
No, why?
Mm-hmm.
What is that?
1, 2, 3, 4, 5.
Okay.
That's your stomach. That's all that poop and gas.
All right. I'm trying, man.
Okay. That's 6.
Isn't that funny that like you can not know that there's a pain until someone? Okay.
Feel it?
Yeah.
Sacrum
Like a
on the
hit,
left.
man.
Okay.
That was sharp. That
Sharp
one
on the
felt-
left, yeah?
Yeah. That felt really sharp. Yeah. Appreciate it.
feel that?
Okay. Yeah.
Yep.
All right.
That's 5. That one?
Okay. Okay.
Or that? No.
No.
That one? No.
No.
That one?
Okay.
Yes.
Yeah.
Had that one? Yes.
Oh, stupid.
That
Okay.
one? Okay.
You're gonna.
Yeah.
I chose to be here, right?
Yeah, you did.
Oof.
That's right. We did your atlas on the left side. I'm getting the pressure here though today on the. You didn't have any fall. Oh, you had the whiplash, which would explain.
Or since?
Yeah.
Is that what you're asking? Oh.
Since I saw you.
Yeah.
The whiplash would explain C6, that one right there. But the question is, where's that one coming from?
Jeez.
6. You're heating up.
Am I?
I feel it.
Is that bad?
Nope.
Okay.
Open the mouth, slowly close. Slowly open. Go. Right, left. Do it again. Left, right, left. Okay, right side is the compensation. That's what you're rubbing a lot.
Yeah.
And this is a good thing that we want to talk about, because what happens is you have the left AI, you have the right EX compensation. So what's happening is that right side keeps going out when you open your mouth. It's irritating on the muscle. And so you're constantly rubbing, thinking this is the problem side. This is compensating for this. However, all this could be compensating for upper cervical.
Okay.
So we'll test.
So it seems like every pain is just a compensation.
In your case, not your C6 and not your sacrum. But that mid-back,
Mid-back
Yes.
and then this
Yes.
are compensation.
correct.
Okay.
Get it?
Yeah.
You ready? Today we'll start on spine. We got a few visits with you,
Okay.
okay? And
Yay.
through the process, we'll see what happens.
Okay.
Okay, fair
Okay.
enough?
Fair.
Stand up, walk it off, shake it off while I look at the x-ray and figure out a game plan for you. So today we're going to do spine, and because I know we have to work on your ankle too.
What's wrong with my ankle?
I mean, your left ankle turns out when you walk.
In a, like a
This-
cute way or?
No, it's, watch, I'll show you. Come over
Oh
here.
boy.
Go on your back over here. Left ankle is going to be tender. She has an AS talus medium tilt.
Don't. I swear.
I
This
told-
happened
See,
last
that-
time.
see?
This happened last time.
See?
It's like you're
Well,
gonna
this
get.
is
I
better.
mean,
This
yeah,
is
but
better.
it's still.
This
I
is-
swear.
Okay.
That's wild.
And then that
Oh
one.
my God.
See, I told you.
It's not bad
You're
pain.
having
He's fine.
Deja vu.
I'm having such deja vu.
So we have, but that's all compensating for the sacrum.
It just doesn't make sense to me that my body wouldn't ever really hurt here until someone's. Well, I guess.
Because it's like saying that, sit up for me, please. Here's a great example. You take a rubber band. I don't have a regular size rubber band, but you have small hands. Let's say I put this on, right? Okay. You feel it, right?
Yeah.
After an hour, what do you think is going to happen?
I won't feel it.
Because the body's already compensated.
to it,
You
yeah.
get used to it, right? And then until somebody comes and says, hey,
Yeah. Okay.
that's what it is.
Okay. That's a good analogy.
Okay.
Analogy?
Analogy.
Is
You
it-
ready?
Yeah.
All right, let's get started. I think we're going to start on the
No.
Tailbone.
No.
Yeah.
Okay.
So look at the x-ray. We said we want to do the left tailbone, S5, and then we're going to do the right.
Yeah.
Sorry, we're going to do the right S5 coccyx to bring that side up, and then we're going to do the rotated sacrum on that side.
Okay.
Okay? Right there. Tuck forward. Tuck. There. There you go.
Okay. Okay.
What?
Nothing.
What?
I appreciate your
Relax
work.
there. Relax there. Relax the bottom leg. Bottom leg forward. 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 Gotcha.
Yeah, that was totally fine.
That's the home run.
That was totally fine.
That's the home run. Stand up, walk it off, check it out.
You can like taste it.
Walk it out. Right side down? Mm-hmm. I'm hoping I get it here so we don't have to go there today.
Me too.
So
Okay.
you better
I'll do very good.
let it go and give it up.
I'll be very good.
Okay? Let it go and give it up. Come forward. There we
Mm-hmm.
go. Okay. Hold here.
Mm-hmm.
Back. This one is going to be the rotated sacrum. S2. Right there. Let that go forward. Let it go up. I got you the whole way. It's easy peasy. That was a baby one.
I know, I did
That
bad.
was a baby
That's
one.
why I look at you scared, because I know it wasn't good enough.
Come up.
I tried.
Walk.
Okay. Oh no.
All right. I mean,
Do we try that again?
no.
Okay.
Because I can't get you on the other side. I already did the coccyx there. You want to try one more time?
No, it's up to you.
We can try
You're the
one more
pro.
time.
You're the pro. I
don't
trust
think-
you.
I
trust you.
I think we are going to go here.
Okay.
But this is different from that first table.
Okay.
It's a little bit more, has a little more cushion.
Okay.
Okay?
Great.
So you may not get a big crack on it, but it will move.
Okay.
Okay, face down. Okay, so
Okay.
tummy down. Okay, now watch.
Okay.
I want to bring it down.
Okay.
Okay, tummy down. Knees back a tiny bit. Knees apart a little bit more. Knees forward a little bit. So let me do this so we can see. So the knees are slightly past 90. Go forward a little more, a little too far. Good. There you go. S2, left side. Okay, I am contacting S2 on the left. There you go. Tummy all the way down. 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 There you go. You got a lot more. Down. Keep going. Now, I'm right here. I'm right here. Tummy down. There you go. Good. Now, the challenge, bring your right knee in a little bit. Right knee in. Okay. There. The challenge is I'm on the left side, but I got to torque slightly up this way to get, okay?
Okay.
To get the sacrum up. Good. Gotcha.
No, you didn't.
Yes, I did.
Okay.
That's it.
It's fine. I'm not crying.
No, you're good.
I'm
Come,
very brave.
come on up.
Okay.
I got a little bit more.
Yeah, because I felt really little.
It was little.
It's okay?
Yeah, it's fine. Walk it up. Keep going. Okay, let's go in the chair.
Okay.
Let's go in the chair. C6. C6 we're going to set as a,
Which one's C6?
that's the base of the neck.
Okay.
Let me just take a look here. You know what? I'm going to do 6, and then I'm going to rescope to see if that clears up the upper neck.
Okay. I can feel it now.
What?
The like lower,
You feel it move?
the like release.
Something happened?
You know, sometimes when you like crack and right away it feels like, the like, whatever the,
The aha? Mm-hmm. Okay.
this has a little like aftershock.
Interesting. Different. Scoot forward a little bit. Okay, come back a little bit. Do, 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 do.
So we're neck cracking right now, yeah?
I am adjusting and setting your neck. I crack jokes, I set bones.
Yes.
C6. I got you. You got to give it though. I got you. Looking. No. Drop it down.
Oh my God.
Gotcha. Not too bad, right? Stand up, walk it out.
Oh no, you're like teasing me.
You forgot. What's that?
You're like teasing me.
What are you talking about?
You know what you're doing.
What are you talking about? Okay, come on back. Have a seat. Oh, you mean it was a little click? Is that what it is? She wants the deep sit?
No, I didn't say that.
Okay, I'm just asking.
Okay.
Chin down.
Okay.
It's a different set. 6 years later, dude. That's it. Come up. It's a different set. Walk it off. Walk it off. Okay, have a seat.
Okay.
Let's rescope. Now the fun part, to rescope and to recheck and to see what changed. We'll see if that's still there. That cleared her mid. Sacrum is clear. 6 is clear. C. Look up a little bit. C6 is clear. Let's see what it did up top. Clear. Walk it off.
And you or me?
What was both? What was different for you for the adjustment? Seriously.
Right now?
All of them. What was different?
They definitely don't. They didn't feel like as like deep or traumatic.
Traumatic?
Seems extreme, doesn't it? Should I say a different word?
No, that's fine.
No, just I think because I'm more comfortable with you and comfortable with the idea of the benefits, like the aftermath.
Yeah.
I'm a very aftermath person, so I think the earlier adjustments I wasn't sure what I would feel after.
So I had to fight through a lot of your defense and anxiety.
I put it all on you. No, I think the difference is
Have a seat.
I don't know, I guess.
Scoot forward a little bit.
I
They're lighter.
Yeah, definitely.
Slowly open. I'm going to do the right side, right there. Open, all the way, open, open. Close, open, close half, hold. There. Nice. Open the mouth, open, close. Open, close. Slowly open. EX. Open. Slowly close. Open again. Slowly close. There. There, 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 there. Ah. That's it.
I chose to be here.
You chose to be here. What are you holding inside?
I don't know, it's a new thing.
You're holding it. What are you holding? It's work.
Yeah.
What do you need to say?
You know what's so funny
What?
that you said that is I don't ever get massages, but I got a massage recently. And the masseuse, just down the street I went.
Yeah.
And the masseuse was like, I don't know if this is out of line, but your throat chakra's like all whack. So
Okay.
whatever you need to say, you should say it.
And
So I told her to shut up.
And you're holding it in your TMJ. I had to.
I mean, it's wild.
I had to.
That is wild.
I had to.
This is why you had me take my earring out.
Uh-huh. No, that was for the x-ray. Okay. On your back. Can I take the sock just down a little bit? So we
Yeah,
can
don't
see?
get on wiki feet again.
Not bad. Better.
Yeah.
Back of the knee. I'm not pulling it this time, I'm using the board. It's going to be a lot easier on you.
Okay.
Relax the knee, relax the knee. It's just the
Yeah, it's fine.
It's the Hollywood sound effects. Come on, let's walk it out.
Okay.
All right, jokes aside, walk it out.
Okay.
Now, tell me if anything is different in the walk and anything you're feeling in the body.
I mean, definitely, my body feels better, feels lighter.
Walk on your toes. You wear heels?
As much as I need to.
Turn around, please. Let's take a look. Do. Hey, some of the swelling is gone.
Yay.
Cool. All right, let's walk. Go ahead. Keep going. Keep going. Let's do the shoulders now. Back over here. Now listen, Leah, that's where I started, okay?
Okay.
I'm not cracking everything in the body or setting everything in the body. We're really going to focus on your foundation this time.
Okay.
Okay, and make sure we get that right before we move up. Let it go. Clunk. Let it go. Let it go. That's it. Stand up. Let's check the hands. Let's do it over here.
Okay.
Squeeze. Face me this way. Squeeze. Scaphoid lunate. Squeeze. Relax, dude.
Squeeze.
Yeah, but just this is a squeeze. That's a.
Last time
Everyone.
we used to do,
Yeah.
you know
but,
why?
What?
Because last time because I have my crystal beads.
Yeah.
And when Johnny and I would come in,
Yeah.
you would do like squeeze, and then you'd like take that one off.
Well, that was the energy, and I was right. You remember? Squeeze. Smile. Ah. Relax there. Easy. Squeeze. Hard. There you go. Why do you lift your shoulder up when you do it? Just squeeze hard here. Go. Go. Oh, because you got no power. That's why. So she thinks she got to muscle it in, right? Compensating. Right side. Now here's the interesting part. You're stronger on your left.
No.
Yes. You're solid. Perfect.
But is it because I'm right-handed and compensating?
No, this is solid right now because you're confident with your left hand when you squeeze. When you squeeze with this, is different. Now you know, so now you're doing it on purpose, otherwise you're going to do that. See? Squeeze.
Okay.
Yeah, it's weak here. So the question is, there you go. Squeeze now. Solid. Squeeze. Now I found something else. Relax there. Radial head. Squeeze. Good. Squeeze. Have a seat. Now you get a buff and polish.
What is that?
Vibration therapy.
Oh, okay. That's right. This is newish, right?
The vibration therapy.
This is newish.
This is different than the percussion devices.
Okay.
You have a percussion device that does percussion. It does this, right?
Yeah.
Yeah. This does this.
Okay.
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 That does this. That's
Yeah.
the meat tenderizer.
Yeah.
You have the meat tenderizer.
I have the meat tenderizer.
You have the meat tenderizer.
Yes.
This is this.
Okay.
Okay. At 10,000 cycles.
And this is more beneficial or
This
just
is
different?
more beneficial because it's working more of the fascia, the adhesions, the scar tissue. It's also working the muscle, but what I like better about this is I can even do this pre-adjustment. I can do it post-adjustment. Typically, I wouldn't recommend any of those machines after an adjustment
Okay.
because it softens it up. And what's going to make the adjustment hold is the muscle. If you loosen the muscle after the adjustment, it's a lot harder. Now, there are some people that will do it before and after, just as a therapeutic effect, okay? If you're gonna do that, I always recommend icing.
Okay.
After getting any of that percussion or deep tissue, soft tissue work after an adjustment, I would always ice the joint. Feel good? Mm-hmm. Nice. 2. Throat chakra, you said?
That's what one lady said.
That's C6 also. But it's right there. I'm actually checking the clavicle. You feel that?
Yeah.
Does that hurt when I do that?
No.
How about that?
It's more tender on this side,
Yeah.
the right side.
Let's go on your back. Crack some more bones. Come on.
Okay.
I'm going to be right here on the SCM. Okay?
You're gonna crack that or adjust that?
I'm going to set it lightly. Okay? Light.
Okay.
I'll show you. I'm not doing anything.
Okay.
I'll explain. I'm applying pressure, medial to lateral, just like this. You feel? Mm-hmm. That's all I'm doing, and at the end, it's going to be a light little thrust. Okay? Just like that.
Wild. That was cool.
You felt it, right?
Yeah. What's that about?
I just adjusted your SCM, which is the collarbone on the front side. So the clavicle inserts into the sternum. SC, sternoclavicular joint. Sternoclavicular joint. So the sternum was out a little bit and over. I set it back. Sorry, it was out, up, and in. So
Up and in,
we
okay.
pushed it down and out.
Okay.
Now, this is going to be really cool. I think he's even tripping on it.
Did he do that to you?
I think he's even tripping on it. Walk it off. Check
That's
it out.
wild.
Move the neck back and forth. Different. Walk.
Yeah, because I feel like my rotation of my whatever was always kind of like blocked, kind of, or whatever. I don't know what.
Okay.
What do you see?
Well, here's the test now. Come back over here. Last motion of the neck. And let's see. Nice. Head down. Turn left. You see, does it pull the same?
No.
And that way.
Yeah, no.
Look up. Left.
There feels like there's like what is it when there's like a little like air bubble that it feels is there? Like when I move like this, it feels as
We
if
call those airheads. I'm joking. It's a joke. What's an air bubble? I don't know what an air bubble
like
is.
it almost feels like I could crack it right now.
Really?
Yeah. Can I show you?
Sure. You can't.
Hold on.
You can't. Come here. How dare you do that after all that work?
What if I
People-
do this though? Listen to this.
That's posture.
Okay. I'll give
Remember, face down. Remember how I told you that you carry the
Yeah.
upper body behind, so all these ligaments and muscles are out of balance? That's what that
Okay.
is. That's you trying to get back into balance.
And I don't want that to happen.
Correct. So that's what we're going to work on.
Great.
Okay? As this gets set, we're going to be here somewhere at some point.
Okay.
Face down, please. What am I doing?
I don't know.
Surprise. I'm actually going to set a little more of the C6.
Which one's that?
The neck, the lower neck.
Oh no.
Lower neck, not upper.
Okay.
Easy. Right there. We're going to use a knife edge contact. Funny term, huh? And I'm just setting it lightly, light. That's it. That's it.
Okay.
Let's pull her leg. Joking. Okay. Jokes aside. Okay. Squeeze. 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 Okay. We're all set for today.
Yay.
So we did a lot of work today, but yet we didn't do everything. Your job, just walk.
Just walk.
You're not working out right now, right?
I'm just walking.
Just walk, hike if you want,
Okay.
and why don't you see me in about 4 days?
Okay.
Okay?
Deal.
Or within 4 days.
Okay.
Welcome back to the office.
Thank you.
Thanks, Leah.